Hey everyone, Dr. Ryan Wakim here. Thank you for joining us for our second podcast. Today we're here talking about postpartum depression with Kim Manfredi, the founder, co-founder and president of the Postpartum Depression Project. And Kim, I'll let you kind of go over some of your credentials from there.
So based on the experience that I had with postpartum depression, kind of brought me to what I needed to do to further help mothers, and that was to get trained properly. So some of the best training that you can get is through Postpartum Support International, also known as PSI. So 2016 and 2020. Also training through Cellini Institute, which is another source for training. They're very different, so it's kind of nice to go to different places. The next thing that for me was the importance of getting trained for suicide prevention, because that was part of my postpartum experience.
Right.
So.
And I want to thank you for coming today. I also want to thank you for, being open with part of your story, and because you're someone who struggled with this and so found a passion in it. And so without, getting too far into it, because I want to let you have that opportunity, do you mind telling the audience kind of a little bit about your story or your experience?
Okay, sure. So I have 4 children, 3 that are adults now at this point, and my 4th was the first time I experienced it. So never had any kind of mental illness prior to that. Was a very happy person. Didn't understand what depression was really, or anxiety. So when it happened to me, I just kept rejecting it. And even though I had people who cared and a support network that was like, there's a problem, you need help, I was rejecting the idea, which meant I rejected the treatment. And so the biggest thing that I kind of learned from all of that was that severity and duration are a mom's worst nightmare. So I went on too long, and the effects were just too severe. So through the suicidal ideation that I had had experience for months and months, it just, one day the planets lined up, and I had a plan. I had, many plans. This plan didn't work right because this would happen. You're really kind of deep in thought on how this all works. So the planets lined up, and I did the attempt, and luckily I was taken to the hospital at some point, and I remember waking up and then being told, you have an option. Either, my husband is going to commit me himself, or I can do that. And luckily, with his profession, he was well aware of the circumstances and what the consequences would be for me if I didn't do it myself. I could lose some of my rights in the future. So I'm glad I listened to that advice, because a lot of things that women don't know right now is that this is treatable and recoverable. And we don't want lifelong effects for moms. We don't want it on them, their relationships, or their children.
So again, thank you for being so vulnerable. That's super hard. I understand that, and I really appreciate that. I think it also really helps the audience understand kind of where someone can get, or help someone who may be struggling with it right now to understand that to let it keep being that way can lead to some really bad things. And so again, thank you for coming up here. I want to start with just kind of better understanding what you guys do as an organization. And then we can kind of dive in a little bit more into, perinatal or postpartum depression and what that looks like and what are the warning signs and then what we do about it. So to start, we mentioned earlier, you're the co-founder and president of Postpartum Depression Project. Explain to me what that is.
So we're a support and advocacy group, and my partner, Jetnali Gonzalez, who is Spanish-speaking, she is able to also have a support group for Hispanic and Spanish-speaking, people. So that's very helpful as well. Gives us that expansion within the group. So the advocacy part of it is getting out there, making sure that we make people aware of what this is, and making sure that we help advocacies such as, like, let's say Strong Moms, Strong Babies. We've been working with them. Pass impactful legislation that's going to make a difference in the lives of children and mothers. So also we work with senators like Senator Cameron Bartolotta. She's been a champion for this whole topic. And 2020 Moms, another national platform, they're great, and so is PSI. There's so many now that help really take that stigma and just break it down so that moms can finally take a look at what this really is without feeling the immense embarrassment that comes with it. The other part that we do is the support group. The support group has been around since the beginning. We're very proud of this because we designed it to be something that we would have needed back then when we were going through our struggles. Jet and Ellie's is a little bit of a different story, which is also great because we can bring in different perspectives. She experienced it with both of her little girls, and she was kind of well aware of it on the second time, and her ability to do medications, not do medications, this kind of comes into her story as well. What we do is we meet consistently every week with these moms. Jet and Ellie and I will go out and meet one-on-one if a mom is in need, which happens often, because we know when a mom needs help, they need it right away, right? They don't have time to make a phone call and, oh, I can get you in 3 weeks. So if we can bridge that gap for the doctors, because they want to see them, you know, we can just help them just a little bit, assist them till they get that appointment, then that's the goal. And then when they come to the meetings, they get to meet other mothers that are going through the same thing, mothers that are just recovering, mothers that have tried medications, mothers that don't want to try medications. So they get a really great perspective of, you know, all different ways that they can go about, you know, taking their treatment seriously and moving forward. We'll do things such as Dropbox journals. So that's basically, we have moms pick up a journal on the way in. They can write what their thoughts are without putting down who they are that wrote it, and kind of getting a dump out of their head of some of the thoughts that are really keeping them clouded or making them feel terrible about themselves. So we'll do a lot of different things with moms, but mostly we like to just let them come there and talk about things that they're afraid to talk about with other people, because will they understand me?
Kim, thank you for all that information. And again, it's awesome what you're providing in terms of resources for new moms or someone who's experiencing this for the first time, maybe 2, 3, 4 pregnancies in. And I think it's really important for everyone to understand that this is actually really common. You know, there's maybe this perception that postpartum depression is a new thing or not very common. But anyway, I know you have a fair amount of statistics around that or some thoughts around that. So can you explain to the audience just how common this really is?
So, you know, it's reported that it's about 20%, but in my personal opinion, it's a lot higher than that because we don't have any state mandates that say you have to report it. So a lot of this is voluntary reporting. I can tell you that within our organization, we've had people who've come and volunteered who said, you know what, and I'm talking retired people, I had this, but no one was around to help me when I had it, and it was terrible. Oh my gosh, I want to help, what can I do? They're some of our best volunteers, because imagine going through that with none of the resources we have now. And man, have they increased immensely. So,
and even getting to that point, there's this idea of baby blues, right? So there's the idea of, and scientifically, you know, we feel that relates to, there's a number of factors there, but rapid hormone shifts, suddenly being maybe a new mom, and then all the situational or social stresses around that. So there's that degree of severity too, right? Mm-hmm. There's maybe a lot of moms statistically who experience some downs. But then, you know, when you look at the data, like you said, somewhere between 10 to 20% really kind of hit that threshold of we're now beyond subclinical. You know, we really are looking at a clinical diagnosis or an issue we have to deal with. Not that the other large percentage who have the baby blues aren't still someone we need to be cautious about, but they're not necessarily counted in those statistics in terms of needing assistance kind of thing, or needing that level of assistance, to your point, where they kind of enter into the system, so to speak.
And that's a really good point that you just brought up. I'm glad you said baby blues and that, because, I'm not sure if we can even get to a point where we're preventative, but, we don't reject mothers if they're going through the first 2 weeks of the baby blues. Come, learn as much as you can, because after those 2 weeks, then it's going to develop into a little bit more serious of a perinatal mood, disorder. So coming first 2 weeks is fine with us, which most people are like, oh, it's just that. That can lead into something more serious.
That's clearly a risk factor for it becoming more serious.
Right.
And I think the other important thing to point out is perinatal or postpartum, those kind of get into diagnostically certain time frames. But the reality is, again, to what you were speaking to earlier, there's a large section of women who struggle even during pregnancy, with worsening depressive symptoms. Again, they may not strike the chord of being truly a depressive episode, but there's a number of individuals who struggle during the pregnancy itself. And then in that 1 month window after delivery, that technically doesn't check the box diagnostically as being postpartum depression, but there's a lot of individuals who struggle in that period as well. So it's really the continuum, not just of symptoms, but also it's common for this to occur in any period of pregnancy, before, during, and after. If I were a new mom or a mother who's struggling with this, you had mentioned some resources earlier. How do most mothers come to you? Is that word of, just explain to me how that happens.
Okay, so a lot of our referrals come from area therapists, OBGYNs. Haven't had too many with family practices yet, but I think that's going to start increasing because, mothers now are feeling more comfortable to talk about it, and they're going to go talk about it with whoever they're comfortable with. So if it's not their OBGYN, it's going to be their PCP at some point, and it can be their pediatrician, of course. I'm finding that a lot of the offices in the area that we're at are doing a really good job of, making sure that they talk to moms about this and give them the resources. So just for instance, today, right before I came here, I got a phone call from a mother who was calling for her daughter who went to an appointment who she could not go in with because of COVID, right? And so she didn't know all the facts, but she walked out with our pamphlet, the Postpartum Depression, pamphlet. And so after talking with her for a while, it just made sense that, we need to get this mom on a plan quick. She's been suffering since she was pregnant. Now the baby's 3 months old. So what can we do? How many more resources can we reach out to help her? She already has a therapist. She already has an OBGYN. So if those things aren't getting that mom along, then us offering the extra support hopefully will work. And then furthering, well, maybe you need to see another, psychiatrist, or, sometimes it doesn't always click with the first one. But just making sure that they stay on that path to recovering.
A lot of what you guys do, it sounds like, is almost functioning as a free social worker, really being that connectivity between kind of the more common early postpartum visits with pediatricians and OB-GYNs, and maybe the conduit through which they end up in maybe more psychiatrically driven care, which is, again, an awesome resource to have, because there's so many mothers, and going back to a point you made earlier, this is not unique to moms, but there's so many mothers who have that that stigma still exists, and they really struggle with reaching out for help, and they really blame themselves. I think mothers really struggle, especially when they can't pin it on something. There are instances, because we know statistically you're more likely to be physically abused during pregnancy than not as a female. But the reality exists when, it's this miracle, it's this wonderful thing that's been brought into your life, yet you feel the way you feel, and it's really tough for mothers who are feeling that way to seek help and to trust that they can talk to their OB about this issue, or that they can talk to their primary care. So again, I think it just speaks volumes about what you're doing, because if you can start fostering that trust and breaking down those barriers to care, we're going to have much more success into the future.
They're going to be more willing to receive that treatment that they need. I remember in the very beginning when we started this, it was a lot of mothers didn't want to talk about it because they're afraid their babies would be taken away. And we've noticed over the years that that's kind of going away to the wayside now. So, you know, it's not us, not just us breaking down these barriers. It's doctors, it's therapists, it's, you know, people finally talking about it. But it's really neat to see that progression of that level of comfort. So some of the feelings of guilt are just so immense with these mothers when they come to us, you know, and they do wonder, they want to know why, and I wanted a scientific reason why. So when I looked for my information, when everyone kept saying I had a problem, okay, I have all this. But guess what? I don't want to hurt my child, so I don't have this. You know, and I think we've kind of stepped away from that it is this dark, that dark all the time thing, to now you can have perinatal mood and anxiety disorders that consist of like depression, anxiety, bipolar, there's OCD, there's PTSD, and of course our psychosis. So they're kind of broken up a little bit different now, instead of just kind of thrown out there like that general term postpartum depression. We kind of now specifically know what our mother's really feeling by using those different components.
As a clinician, there's been, you know, many cases that I've seen where postpartum wasn't necessarily a depressive episode, but anxiety. Or I've seen a couple of really triggered OCD episodes after delivery. So it doesn't, you know, we're talking, it's Postpartum Depression Project. We're talking a lot about postpartum depression, but the reality is, you know, those life changes and hormone shifts can really unearth any number of you know, mental health concerns or issues. The other thing I wanted to speak to that you had mentioned earlier as part of your kind of credo, or what you guys are all about, is awareness, right? And I know there's the Stephen D. Achille Center here, and actually I was involved with Mon Health Center in Morgantown developing what they're trying to do, you know, kind of mimic that program, like a mother and baby program, specifically for perinatal and postpartum. And so I think, as you alluded to earlier, there's a lot more focus on this. There's a lot more resources going towards this. And you happen to be one of those important resources. So what have you seen, you know, over the last 5 years or more in that regard, in terms of, you know, furthering awareness and reducing stigma?
Well, it is people like Stephen D. Achille who are kind of carrying that torch and not letting it blow out. Same thing with Dr. Sarah Hamitsky. I mean, she is just absolutely brilliant. I'm a huge fan of hers. You know, they're out there being heard, and that's what we need. We need people to be heard, and they have the ability to make that happen. So the other thing is that, you know, while Alexis Joy Foundation, the West Penn Hospital is up in Pittsburgh, it's still something that we talk about with our mothers that are in desperate need of that help. So what's neat is that it's available now. We have this. It is an option, and we didn't have that before. So locally for us, we're in Washington County. There's not a lot that exists, but it's expanding everywhere. And like you just said, the Mon Valley now, I did not hear that one, but that's wonderful. So it's another thing that's going to exist for us.
Now that we've discussed a lot about, you know, advocacy and awareness and, you know, what this looks like for the mom, let's shift gears a little bit, because we're really neglecting we're neglecting two other people in this equation. One is the baby, right, the newborn, or the children in the family, and one is the father. So which do you want to talk about first?
Okay, let's talk about dad. I mean, dads are dads are great. They're like superheroes, right? Dads, They can suffer just like a mom. I refer to it more of as a parental depression than postpartum depression. But they have hormonal shifts too. I mean, they're all of a sudden this new creature exists within their lives, and so it's quite possible. I mean, the statistics are right around 9 to 10% of fathers, and most fathers don't go for treatment. Again, where are they going to go? Let me just offer up a few places they could go, because that's important too. PSI definitely is an important one. They've taken a lot on with this, so they have, you know, the support groups via telehealth right now for fathers and for military fathers and mothers too. So that was pretty neat. But fathers, it's you know, they have questions and they think they can just handle everything themselves. A father is actually 50% more at risk of getting this if a mother is experiencing it. I guess that kind of makes sense because they even gain the weight during the pregnancy. You know, they kind of help us out and get those postpartum twangs.
Hey, evolution's amazing, right?
Yes. So we don't want to ever leave dad out. He's important. And, you know, a lot of our dads are the caretakers of our mothers, and they are the strongest supports our mothers have. And if they get tired and exhausted because mom is going through this, you know, that can cause problems too. Really wear them down. So we don't want that.
Yeah, I mean, I think it's pretty obvious, right? It's something that's not been a focus of conversation, and you know, over the coming years, I'm sure it will become more mainstream or more well understood or known. Statistically, it's probably also being underreported. But you know, again, it makes sense. Just when you're sharing the same stresses, you're involved in those same day-to-day things, especially taking on the caregiving piece in addition to some of that. It makes sense why it's certainly, obviously, a thing. And to your point, and we know this across the board for all mental health conditions, women are far more likely to get help or ask for help than a male or a man is. And so, again, to your point, it's something that's not really being talked about, and it's a population that's not very likely to get help. So I see in the coming years that being a real focus of how do we get resources and how do we get awareness out about that specifically.
Yeah, I do too. And I hope that that does happen. I'm sure there's a champion out there that's going to take up this cause and further that research for the dads.
Pivoting once more, we've talked about mom. We've identified this exists in dad. Let's talk about the baby. Let's talk about that. First off, just what do we know in terms of the baby?
So what we know in terms of the baby is that there's a lot of research right now out there in this. I mean, you can go and find a lot that you can read. So the parent-infant relationship can be affected, immensely by the inability to bond. We all know that. So how do we increase that bonding with the mom? Things are getting so much better in this area too, because once mom is identified, then guess what? Well, now we know that baby needs help too. Got to get them into early intervention supportive systems and help them, we'll help them with, just acknowledging the cues the baby's sending them. And it could be as simple as just singing, eye contact, stuff like that. But it affects the child not just there, but it can affect them, later too. The longer it goes on, the more effect it's going to have on any child, actually. So I can speak to when I went through this. I thought I did everything possible, but really when I look back, I did just everything I had to do. So I fed him, I, rocked him, I bathed him, I loved him, and I thought that was enough. So, and he's not really struggling now. He's 10 now, but I can definitely still beat myself up and say, I wonder if I'd gotten the help I needed sooner, if these effects, you always wonder, is this really because of me? Is this still lingering and my fault? Getting that help soon for mom is going to help lessen the effects of the child. It could be cognitive, behavioral, and many, many other things. I mean, now they're talking, there's studies out there that it could be linked with ADHD. And I'm not sure if that's the case or not, but, you know, we always like to read our studies that come out, and now they're talking about that.
What's important to point out in all of that, when we look at it as a clinician or scientifically, a few things. Number one, it's important to realize, and we have this discussion a lot with pregnant mothers who already, you know they have depression or anxiety, and they're on maybe a medication during pregnancy. When you start talking about drugs in pregnancy, there comes with that a myriad of questions and concerns and the guilt of, am I doing something to the baby? What we know is statistically or scientifically, when mom is under stress, when her cortisol levels are elevated, her adrenaline levels are flowing, and fight or flight responses are in, that will directly impact the baby, the fetus, that will directly impact the child before they're born, and does increase the risk down the road of them developing depression or anxiety, and as you mentioned, maybe even ADHD. So whenever I have a mother who's, currently pregnant, the conversation really is a risk-benefit of what's the risks of the medication to you and the baby versus the benefits of avoiding some of these things, because if you're stressed, baby's stressed. And that then spills over into after delivery, those same things exist. When mom's stressed, when mom's depressed, when mom's not making good eye contact or not developing that bond, that then can lead to some of those same things down the road. And to your point, it's often duration dependent, right? So if that happens for a few weeks, that's very different than if it happens for a few years. So it's, I think to the point is, it's not only critical for mom to get help, it's critical for baby that mom gets help or that mom and dad get help, because it really does impact the entire family, not just one person.
Yeah, we keep saying that. It's not just mom, it's the entire family. Marriages, so many marriages are impacted by this in negative ways because, your partner becomes someone you just don't recognize anymore. And, but it looks different for every situation. Every mom, it looks different, but there's a lot of marriages that don't survive a treatable and recoverable, condition.
So I guess the final points I want to make, or the final topic I want to hit on regarding this is treatment. Mm-hmm. So we've talked a lot about awareness, advocacy, identifying individuals that might be at risk, not just moms, babies, dads. Let's talk a little bit about treatment. So what you guys are offering is a lot of self-help, a lot of supportive therapy services, or again, self-help groups and such. Just briefly go over again what it is you guys can offer, now in your location or at your location.
So yeah, you can kind of, if you want, you can call it cognitive therapy because it's really just talk therapy, right? But it's based on being able to relate to the other person and on their level and using empathy and no judgment. So there's a lot that comes in with that. That alone is like golden. But what's really neat is our moms will share with us, I'm on this medication and I'm at this milligram. And we're then able to check in with them the next week. How are you feeling on that? Are you having adverse effects? And they'll share, I haven't been able to eat. I can't, well, maybe you should call your doctor back. Maybe you're too high right now and they need to take you down a little bit. So it's nice that they can have this conversation in a forum with other mothers who are saying, I would never take medication. I will never do that. And then in 2 or 3 months after they realize it can help, they're like, I'm going to call my doctor. I may need that extra help. And it's not forever. When I took medication, I took it for 8 months and it saved my life. It was going in, getting the right treatment, getting assessed properly, and then getting on the right medication. That made all the difference. But we do have moms who want to do it holistically. They want to do it with, the new marijuana. They want to do it with just exercise. And so we support them whatever they're going to choose. But what's great is that we're there to give them all the other ideas that they might need to get on the path to maybe a better, more manageable treatment, which I always say the medication that I took saved my life. So,
moms also oftentimes will have concerns about breastfeeding and does it get into the breast milk? So there's, again, when we talk about drugs or, medication for postpartum depression, there's a lot of factors there too, and a lot of things we have to consider before we do that. There is talk therapy, as you said. There's, and that can be in support groups like what you offer. That can be with an individual therapist. There are actually other treatment modalities, and one of which I specialize in. So I'm going to throw a little plug out there for it. So, the other treatments for postpartum depression include things like TMS, which is transcranial magnetic stimulation. And you've had some experience kind of secondhand with that, where we're really using electromagnetic energy to reconnect areas of the brain that get disconnected in high stress or, depressive episodes or, for whatever reason that might be. So what's nice about TMS, as you know, is it's a very focal treatment. So it's not systemic with the medication, so the side effects don't exist. The risks of it getting into the breast milk and to the infant don't exist. And so it's, there's some studies on that right now as well, but we've effectively treated mothers. Actually, we've treated a few mothers during pregnancy and some mothers after pregnancy using that non-invasive transcranial magnetic stimulation.
Yeah, that's a really exciting possibility to have. That option is nice because so many of our moms are like, no, they're resisting the medications, the drugs, and that's okay. Let's find a different way to get you help, and if that can work for them, and if there is, and I'm sure there'll be more studies coming out, that's just another ray of hope, another opportunity, just like all these other resources that are popping up. So TMS is definitely something that will factor in for a lot of our moms in the future.
It's actually really interesting. So our very first TMS patient was postpartum depression. Her name's Heather. She's actually done some testimonials for us before, but what was really cool about that is a year had passed from when we treated her, and she went from very severely depressed to not. A year had passed, and I was actually about to get up and give a grand rounds at a hospital. And it turns out her mother-in-law was an administrator at the hospital, and she came up to me and she said, "Dr. Wakim." I said, "Yeah." She said, "Do you remember me?" I said, "Yeah, you look familiar. I can't quite put a finger on it." And she said, "If Heather hadn't have met you, she'd be dead right now." Obviously, it still chokes me up to this day. That's when I saw that. When I saw what it did for Heather, I couldn't unsee that. So for me to not offer this as a treatment, for me to not help people with this treatment, it just so happens, relevant to this conversation, the whole thing that kicked this off for her was a very severe postpartum depression. And again, we've treated several mothers since. So not a ton. You won't find many medicine companies, pharma companies or device companies are going to treat or do trials on mothers who are pregnant because of just the liability risk. But it absolutely can help, and again has helped several of our patients.
Oh, that's amazing. That is wonderful to hear. Just to be in that position where I was in and to hear the hope that she had of something that was a very different option, and where she's at now is amazing. That's great testimony.
Yeah, I mean, again, it's why I do TMS now. And the final thing I don't want to not mention, although for much more, technically for more severe cases, but also used, is ECT. And I know that has a lot of stigma behind it, but the reality of it is it's highly effective. and it's very safe in pregnancy, or again, postpartum if need be. So the reality is there's now a lot of resources available. There's a lot more awareness. There are more and more treatment options coming down. In fact, I don't want to forget to mention there's now an infusion, a postpartum infusion drug or medicine for postpartum depression. So it's obviously an issue. There's a lot of awareness around it, and we're making progress.
Yes.
But we can only do as much as someone will let us do. True. And so to your point, having someone they can trust, being able to bounce these questions or issues off of other mothers is so critically important. And to serve as that conduit between kind of traditional medicine, postpartum, and the mental health community is, again, so critical. So I want to thank you for what you're doing, because that's so needed and so important.
Yeah, we thank you too. It's people out there still trying to make things happen in innovative ways, doing studies and research, and in effects that are going to be lessened for the mom medically. Can't find that everywhere. So, and this TMS is definitely a promising frontier for women who are experiencing this.
I think at this point we've touched on everything that I can recall or think that we need to be touching on. Do you have anything else you'd want to bring up or make sure the audience knows?
I guess what I'd bring up the most is that, you're not alone. If you have questions, don't be afraid to reach out. It seems hopeless, but it's not. And the most beautiful thing that can happen is recovery. And it's like seeing color for the first time again when you do recover and you don't believe it'll happen. So I guess that would be my message. Don't be afraid to reach out. Look at everyone that now is coming together and really taking the stigma and all of the shame out of this and working together. We all seem to be working together pretty good these days. So
absolutely. Kim, again, I want to thank you for coming up. We'll make sure we put all the resources you've mentioned at the bottom of the podcast so people can click on those and get that information and resource. Again, thank you for all the work you're doing, and we look forward to collaborating closely together into the future.
Yeah, thank you. Thank you so much for having me and for having the Postpartum Depression Project today.
Absolutely. I want to thank everyone for listening today. This concludes our second podcast here at Mental State. Don't forget to follow us, and we will be bringing you some more important content in the next couple of weeks to come. Thank you.